everybody, I'm Dr. O and welcome to the Dr. O Method YouTube channel, where I try to give you a little bit of education and some insights from a medical doctor's perspective. Today we're going to talk about how to succeed when taking Ozempic, Wegovy, or Mounjaro. Maybe you're somebody who's taking the drugs, wants to succeed, but needs to know how. Or maybe you're somebody who's taking the drugs, is not losing weight, and wants to know why. Or maybe you're somebody who just wants to know more. Hopefully, this video will give you the answers you need. There are 4 things you need to know. First, you have to have patience. Second, you have to understand and manage some of the potential side effects. Third, you need to hydrate. And fourth, you need to know what to do when you think the medicine has stopped working. First, let's talk about having patience. Why do you need to have patience in order to succeed? Sometimes you're on your program, you do your weekly injections diligently, but you still don't lose weight, at least according to the scale. Why is this? In order to understand why, you need to understand a little something about fat. There's different types of fat. You might have heard of brown fat. Brown fat is the fat that's readily available that our body converts quickly into energy. But then there's white fat, and white fat is that fat that you want to lose. That's the muffin top. That's that fat that swings in the air when you're trying to get a cab. But what you might not know about is fibrous fat. This is the stubborn fat. This is the fat that sometimes we see in the form of a really hard, big belly. But also, sometimes fibrous fat is deep in our bodies, so we may not even know if we have it or not. With fibrous fat, you might not see a change in the scale, despite the fact that you're being really, really good and you're taking those injections every week. Don't think that the medicine is not working. Fibrous fat is stubborn and it's hard to lose. During this period when the scale isn't changing, think of it like the fibrous fat is softening so that your body can actually get rid of it. So don't think the medicine is not working. Just think of it as going through this softening process. By the way, if you don't want to have fibrous fat, you need to minimize refined sugar, especially sugary drinks like soda. And yes, wine. The second thing you need to know to succeed on Wegovy, Ozempic, and Mounjaro is to understand and know how to manage side effects. The most common side effect is nausea. The good news is that usually nauseousness goes away after a couple of weeks on the medicine. But let's say you don't really like to be nauseous or you really can't tolerate it. You can actually take a B12 injection and this will help to minimize some of that nausea. You just take it every week while taking the medicines. So maybe you're thinking to yourself, but Dr. O, I do take B12 and I'm still nauseous. Why? What's up with that? Guess what? I have you. Some people don't do a process called methylation. What's methylation, Dr. O? Well, let me just put it simply. It's a chemical process in your body that's required for B12 to enter into your cells. Most doctors give a form of B12 that is not methylated, and they rely on your body to methylate it so the B12 goes in the cell. Maybe you're that person that doesn't methylate. You need to take methylated B12, also known as Methylcobalamin. Just ask your doctor for it. The third thing you need to know to make sure you succeed when taking Ozempic, Wegovy, or Mounjaro is hydration. You have to hydrate. All the fat that you're losing, you actually pee it out. When you pee, it's all the waste in your body. And when you're breaking down fat, the waste of the fat exits your body through peeing. So you have to hydrate to pee. I know what you're thinking. You're saying, but Dr. O, I drink a ton of water and I'm peeing all the time. That's the problem. You're just peeing out the water. Your body is not holding on to it. Your body needs to hold on to the water so that it can be used in your body to ultimately eliminate the waste. How do we hold on to the water that we drink? Electrolytes. Yes, electrolytes, the ultimate rehydrant. Electrolytes are minerals. How do I get electrolytes, Dr. O? Do I have to buy the packet? You're supposed to be eating, 4 to 5 servings of fruits and vegetables a day. And that will give you all the minerals and electrolytes you need. But who does this? Like nobody, like 4 people. It's hard to do. So that's why I recommend taking electrolyte supplements. This way, you're honest with yourself because you're not eating 4 to 5 servings of fruit and vegetables, but you're getting the electrolytes, so all that water that you're drinking, you're actually keeping in your body. And the fourth thing you need to know in order to succeed when taking Ozempic, Wegovy, or Mounjaro is what? Oh my gosh. The fourth thing you need to know is what to do when you feel that the medicine is not working. It's ticking along, doing great, and then suddenly the scale isn't moving. Your measurements aren't moving. One obvious solution is that your dose is too low, and you just need a higher dose. But remember, if you're taking the brand name Ozempic, it only goes so high. Whereas Wegovy, you can actually go to a higher concentration, meaning a higher dose. This is something that you can discuss with your doctor. But remember, Mounjaro is a totally different drug, tirzepatide. While it's a different drug, you really can't compare them so easily. Just know that in your body, maybe tirzepatide is right for you. Dosing and understanding the different concentrations of the medicines is key in order to make sure you are successful in continually losing weight. But wait, there's one more thing that may result in your medicine not working that's not related to dosage or concentration, and that's your insulin levels. This is where you may want to ask your doctor to do some blood work and check your insulin levels, especially if you are not diabetic and you're taking these medicines for simple weight loss. Sometimes your insulin levels get too low, and in this case, the medicine can stop working. Remember, weight loss is a process. You'll have good days, you'll have less good days, but overall, just stick with the program and be good to yourself. Don't be so hard on yourself. You're just human. Well, thank you so much for joining me. And if you have any questions, please, in the comments, just tell me what you want to know, and I'll do my best. Or if there's any topics that you want me to discuss, just let me know. This is a new YouTube channel for me, so I'd love any pointers, any feedback, any insights that you guys may have for me. Thank you so much for joining me. I hope you have a wonderful day, and I hope you succeed on your weight loss journey. This is Dr. O saying goodbye for now.